sort of a self-serving, so here I just decided to summarize at a high level on some of the recent data not yet published as a sort of an update from our own and what we know as new in research on the myostatin pathway. As the title shows, I would like to talk about the roles of myostatin activin signaling pathway in three aspects: cardiac atrophy, insulin resistance, and disuse atrophy. So let me begin by talking about the atrophy of the heart. It's kind of an important aspect of cancer cachexia, if you will, at least based on our insight through our animal model studies using cancer cachexia models. So let me put things in the right context by showing a couple of slides which we published, the figures, a couple of figures which we published in the Cell paper last year. And here you see this is the colon 26 cancer cachexia model. In terms of body weight change, the red curve is the cancer-bearing animal's body weight, you can see. And the important thing here is that by blocking the myostatin signaling pathway using the decoy receptor, nectar 2B soluble form, not only the treatment was able to prevent weight loss, you see the green curve, but more importantly, it was able to reverse the weight loss and muscle wasting. It's not shown here. And as a result, significantly prolong the survival of these animals. And in another model here, is a gonadal tumor model, just spontaneously formed gonadal tumors in males, testicular tumor, and in male ovarian tumor, quite large actually by this stage, shown here, the age here. And so similarly, when we dose these animals with a soluble agent, soluble receptor neutralizing myostatin activin, and you see not only the reversal of lost weight, but more importantly, a dramatic improvement in survival. So what happened was that when we looked at the heart was not spared. So it selected the skeletal muscle. There was an atrophy of the heart. In fact, if you look at the clinical literature, this is quite relevant. There was reviews that was not really appreciated somewhat, showing, documenting the loss of the heart weight in clinical setting, including patients with cancer or anorexia and so forth. So here is somewhat kind of if you see the heart getting smaller, you have two reactions. First, of course, the animal is smaller, okay? And two is, well, the heart didn't do too well because it should have resisted this wasting better. So that's the two reactions, but nonetheless, we published this data. So now I'm going to turn around and show you something new. So when we look at the heart histologically, the heart, in fact, is not only smaller, but it looks different. If you look at the tractrum stain in this particular slide, and showing the colon 26 and the knockout heart, you can see fibrosis clearly. But the nice thing is that when we treated these animals with the soluble agent blocking the myostatin activin signaling pathway, and you don't see these anymore. So the heart was well protected in that sense. We also analyzed markers of heart failure, and in this case, it's just a baby form of myosin, it's shown here, and in a sort of a histology setting. And by the way, we also have molecular biology, in terms of northern or quantity PCR showing the same thing. So these, this particular slide shows the induction of this baby form of myosin indicating the stress of this heart is not doing well functionally. So later I'm going to show you functional data to corroborate this, and here is exactly what we try to do. We took a reductionist approach by grafting into the nude mice with a CHO, using a CHO, activin transfected CHO cells, and grafting into the animal. So it's sort of a special tumor, but it's a simple, involving a simple vector activin. So with activin overexpression, we saw the heart getting smaller by 30%. This is assayed by 11-day post-implantation of the tumor. And here you see the survival. The animal didn't really do well. It died very quickly. But again, treating the animal with a soluble agent really protected these animals from the activin-induced wasting. So this is the functional analysis we did. We used echo to image the heart. You can see this is sort of the dynamics of the control heart, and here's the activin plus the soluble receptor treated heart, and they work pretty well. And the activin treated heart did poorly. And if you look at this, analysis on these parameters, really together we sort of suggest a heart failure. I think in some way it's safe to say that when severe cachexia happens, heart probably is a big issue here, and heart function. So heart failure in cancer probably something neglected, and we need to pay more attention. By saying this, I think I make some people happy, at least if Stefan is in the audience, certainly, because his spirit early on, and we're glad to show some data here. So the second aspect is about insulin resistance. Here, just quickly show two pieces of data. So first, is all the data I'm showing here were generated from this LDL receptor knockout plus high-fat diet mice. So these animals, they develop severe insulin resistance, and you can see here the serum insulin really shoot up, the red compared to the wild type, and with the treatment, with the soluble receptor treatment, we could reverse this upregulation of insulin, serum insulin. And here is the ITT test. You can see there is a insulin intolerance in this diseased animal. If you think this is some kind of a metabolic syndrome, mimetic model, and you can see that insulin didn't do well. But with the treatment with the soluble receptor, then you can see that the animal did much better. So that's a sort of a suggestion at one level that the animal, by growing more muscle and whatever other changes, which is not shown here, they did better in response to the insulin, suggesting an improvement in insulin sensitivity. But here is a more definitive measurement. We really worked hard and performed glucose clamp experiment, and it's a busy slide. Let me just show here this glucose infusion rate under a clamp condition in this diseased animal. You can see the glucose infusion was not much, but after treatment with the soluble receptor, you can see this glucose utilization improved pretty dramatically. So that's the hard evidence showing that blocking the myostatin signaling was able to stimulate insulin signaling. The last part, I just wanted to focus on the disuse a little bit here. I think this disuse is, for muscle, is a very, very important component, not only affecting aging population, but especially perhaps in various disease conditions like cancer, like trauma, and so forth. You pick up your condition, you will see disuse. So how to do a disuse study? The approach that we took was a sort of an extreme form. Our phone ran, and when we picked up the phone, we realized there was some interest expressed about NASA. And the reason for that was simply, probably can be highlighted by this slide. Here, we're human beings. There's a spirit to explore and long range in the future. So if you want to go to Mars, the short and long of the journey is illustrated here. It's a slide provided by NASA. And two scenarios. If you stay short in Mars, you're going to still be subjected to microgravity more than 600 days. And here, the long version of stay, and you're going to be really staying the journey for more than 900 days. So there you see for NASA, preserving the muscles health was more than important. It was very important. So we wanted to do the study. So now let me give you a sort of a heads up of what we got in terms of data. So what we really did was to give the animal one injection right before the taking off of the space shuttle. So these animals were subjected to a 14-day, a couple of weeks of exposure to microgravity. So when this animal came back, they were then analyzed for muscle mass. And here you see the blue bars showing the lean body mass and individual hyaline muscle mass, and the decline compared to the ground control. In contrast, the treatment mitigated the muscle mass pretty much. And in fact, for some muscle, they grew, this muscle grew bigger compared to the ground control. And that's not the whole story, because the disuse in space was well known for not only muscle loss, but also for bone loss. And this is what happens in terms of the bone loss. You can see the bone volume at 14-day exposure to microgravity really caused a lot of bone loss. But the nice thing is that the compound with one injection completely mitigated the bone loss and also the loss of bone strength. So this pathway was effective in protecting both muscle and bone and in ultimate microgravity disuse. So here I wanted to end by saying we showed three elements. One is the cardiac dysfunction related to this pathway. Another was insulin sensitivity, and third was disuse. And I wanted to thank my team for their hard work, and also wish to take this opportunity to thank NASA for their interest in muscle testing.
Thank you very much for this excellent presentation, which is now open for discussion. Any questions? Use the microphone, please.
It's you. Why do you think the soleus muscle loses such great part of its mass during space flight? Because it's a slow fiber muscle. And if we see wasting disease, we're usually losing fast fibers. So in that case, the EDL should have been the one that's losing most of the mass.
Oh, that was a very important question. It's been validated in previous rodent studies, space flight, that soleus muscle lost the most in terms of wasting. And the reason for that was not too clear, but if you do the hyaline suspension, it happens the same way. So in other words, the weight unloading for the hind limb involves most atrophy as a hallmark almost for soleus muscle. So that's what we know. It's different from aging, perhaps, and from cancer. That's a fact. Yeah.
Any speculation as to the mechanism by which myostatin or the anti-myostatin treatment might interfere with might facilitate insulin sensitivity, apart from the increasing muscle?
The insulin sensitivity was a finding that we believe reflect multiple aspects of the changes in the dyslipidemic animal. First, the fat loss and hyperlipidemia. I think the decrease in hyperlipidemia contributed to this improvement in insulin sensitivity. The other clear sign we saw was the drop in the intracellular lipid droplet, the large particle, lipid particle gone with treatment. So, these aspects are important, and also the liver, fatty liver was gone. So there was a lot of changes in responding to this pathway, but muscle was part of it. We just don't know too well, but we know some molecular mechanisms, but we will publish this hopefully soon. Yeah.
The very last question.
Thank you for your interesting talk. Given the case that your NASA group reached the mass with preserved muscle, will they be able to use their muscle coordinatively? Will their coordination, their postural competence enough to use these muscles? Muscle mass is not enough to move around.
You're saying the muscle mass in the space flight situation?
Yes. If we are able to preserve the muscle mass in spaceflight.
Okay.
I have participated in the Berlin bed rest study, and I've seen the persons rising from a bed 2 months later, and they were not able to turn around and to walk.
Okay.
Also these with enough strength.
Personally, I don't think this is enough. You have to find other ways to train this muscle. Just like you do a clinical trial, you need to introduce some training exercise to use this muscle. Generally, this muscle is sort of a baby muscle. You're going to have to use it. But in a space flight setting, I think this is one step as a proof concept to point to the fact that you can have ways to mitigate the loss of muscle mass at the beginning. So how to get the muscle really, really toned up so that you have a very healthy